Day one.
Good afternoon. You must be
Polyester?
polyester?
Yes,
Miss I'm
fabric.
Sammy. We spoke yesterday on the
Hi,
phone.
Sammy.
Just stand over here, please.
That was you. You were lovely. Thank you for your help.
Thank you. Did you find the place easy? Did you
I
find?
did.
Perfect. Great. Would you follow me, please, Miss Polyester? Can I call you Polly? Is it all right?
Polly's fine.
Miss Polly, have a seat over here. This is my application for care. It's 4 pages. Last one, quick part.
4 pages?
It's 4 pages, but I would like you to be as thorough as possible. The medication, and then this is hepatitis. Everything's confidential.
Okay.
Do you have your insurance card? I can make a copy, please.
Oh, yes.
I thank you.
Thank
Here
you.
you go. When you're done, please let me know, and I will help you if you have any questions. Thank you.
And now she's done.
She's done. Perfect. Miss Polly. No, you're supposed to. Okay. Here you go. Your insurance card. Thank you so much. I'll be right with you, Miss Polly. Be present. Miss Polly, I would like Polly. Thank you. If you have a cell phone, just put it on vibration or just close it for a good
It's
30
off.
minutes. Thank you. I would like you to do this very important procedure about subluxations, and when you are done, please let me know.
And she's done.
Miss Polly, would you be? Did you read it?
Yes.
Good. In your own words, can you explain to me what subluxation is?
Oh, I don't know. It's when my back hurts and like then my arm hurts and I have pains in my neck.
Yes. When you have a misalignment of the two vertebrae, and then your brain and your body doesn't connect. An example would be low back, your neck pain, and everything else. We're gonna watch a very informative video about subluxation, and then we will take you in for your husband with the doctors.
And video is seen.
Miss Polly, let me take you in. I would like you to have a seat over here. Do you have a better understanding what subluxation is now?
Oh, yes.
Excellent. I'm gonna take your blood pressure. Good. Just uncross your fingers, your legs. Thank you. Great.
Oh, it's not good.
If you're concerned, we will take it one more time before to leave. Great. Let me get the doctor. Doctor will be shortly with you.
Thank you.
Hi, Polly.
Hi,
Dr. Jet.
Dr. Jet. Nice
May I
to
call you
meet
Polly?
Please.
Great. Okay, Polly, first thing we're going to do today, before we go in, we're going to take a very thorough history. We're going to do a complete evaluation of you. But before we do, the first thing we want to do is we want to get a sense of if what's going on is even chiropractic related. Does that make sense?
Sure it does.
Okay, so the first thing we're going to do is we're going to do 2 simple screenings. First, we're going to check your structure, which is your posture, because that shows us how your body's been adapting to various stresses and strains on it. The next thing we're going to do is while you sit right here, we're going to do a gentle palpation of your spine. And that is where, when I use, for example, on my model, we're going to feel from the bottom to the top of your spine to see what's moving freely and what areas may be locking up or fixated, which is a component of, like my diagram, the subluxation that you had read and saw about. Okay?
Okay.
And if either of these are showing us any positive signs, we know that subluxation may very well be a cause and that you're probably in the right place. And from there, we'll see what we need to do further, okay? And the reason that we're not going to also start by asking you a lot of questions initially is because, number one, we don't want to predispose ourselves sometimes into what a patient might think the problem is, or worse, looking over your application for care, I see you've been to a number of other doctors, so we don't want to duplicate what doesn't work.
Okay.
Does that make sense?
Makes sense.
Okay,
Sure.
so the first thing we're going to do is let me have you stand here. I'm going to have you stand and just face the mirror, and I'm going to call off to my assistant Sammy, who's standing off to the side here. Sammy, we have, first we're going to have you close your eyes, drop your head down, bring your head far back as you can, come back to the center, and just hold still. Sammy, we have some right translation of the head. We have a high right shoulder, and we also have a left high hip. Don't like that. We see from the side, we have some forward head positioning, and it also appears that neck is fairly straight. Now, what I'm going to do, Maria, is I'm going to reposition you a little bit.
Mhm.
We're going to just gently shift that shoulder a little. We're going to gently move that head a little bit, and I'm going to have you just bring your head back slightly, okay? Can you describe to me how that feels?
It feels awkward.
A little odd, doesn't it?
Yes.
Yes, okay. And let your body relax, okay? Well, what we did was we put you in a normal posture,
Mhm.
but this is how your body perceives normal. So, a little different, yes?
Yes.
Okay. Now, if you would, let me have you have a seat on the end of the table there, and just sit so your feet are flat on the floor, okay? All right, and I'm going to just sit behind you, and I'm going to call off some areas. If there's any area that you have any sensitivity or if you have any discomfort, let me know.
Mhm.
But I'm feeling simply for what's moving freely and what isn't, okay?
Okay.
So we're going to start down here, okay? And does that feel easier on your right or on your left side when I press here?
On the left.
On the left, okay. Sammy, would you please make note, right SI and L5, and also T11, T5, T3, and we're going to check up here a little bit as well. And just let your head relax. We're just going to put it through a little movement. And C1 and C2 on the right, and C5 left. Okay? All right. So now, Polly, if you would, come around this way.
Mhm.
All right. Now, just based on what I'm seeing here, both in your posture and your palpation evaluation, both of the screens look like there's a good possibility of subluxation. So my recommendation
Mhm.
is that we go ahead and do a more comprehensive evaluation. We're going to check things like ranges of motion, some balance. We'll do some other checks as well, all right? And I'm going to want to take some pictures, some x-ray pictures of both your neck, upper back, and that mid and low back as well, because we want to see if there's any degeneration or arthritis that's been settling into any of those areas. We want to catch them early rather than let them continue
Oh,
to develop,
absolutely.
even though they may not be painful, okay?
Yeah.
Does that make sense?
Absolutely.
All right, great. So just a couple things I want to go through with you before we start is, number one, up to this point, this has been done at our expense because we feel it's the most appropriate way for a doctor to see if the person in front of them is even somebody who will benefit by the care that we offer, okay? So up till this point, that was at our expense. There will be a charge for your evaluation. Your examination today is going to be $98, and your x-rays that we're going to do will be $100. So today when you leave, that will be $198 that you'll take care of on the way out, okay? Any questions?
Okay.
Good, okay. Now, the next thing we do is, on your next visit, which is included in today's fee, is your doctor's report, or what we call our report of findings, okay?
Mhm.
And at that time, we're going to go over your x-rays. We're going to get them developed this evening, analyze them. Dr. Kathy, who's my partner and wife, we always go over everyone's findings together, so you actually have the benefit of the two of us, all right? And we're going to look those over. We're going to analyze the films, compare them with the evaluation that we're going to do today, and come up with a plan. And that plan hopefully is going to let us know things like time, frequency, intensity, meaning how long are you going to need to have care, how often we're going to need to see you, and also intensity, meaning that we're going to talk about ways to better improve your health, because we're very big on education in our office. Many times we'll often say that education is almost more important to teach our patients than the adjustment itself, which is, again, about the realignment of the spine, okay? So the next time we do that is on Monday at 10 o'clock, all right? And I see you work. Will you need a work note, or will you be able to be here?
I will be here.
Okay, great. Now, the other thing I see is that you're married, and one of the things that we do is anytime anyone is in a relationship, such as marriage, we also like to have the spouse present. Now, they never need to come again after that visit. but we do like to include them in the process simply because they should know what's going on with you and what needs to be done. So, I see that your husband works. Will he need a note also, or will he just be able to come?
I'll have to check with him, but he should be able to come.
Okay, great. So we'll go under that assumption. If there's a problem, then just please let us know,
Okay.
because we will be talking about things like your insurance and finances and things like that. And I know the first thing when most patients get home, their spouse usually asks them, "So what'd they say?" So we want to include them in that.
Mhm.
Okay, and then and other than that, we're going to get going. I'm going to have Sammy come back in. She's going to go through, do your evaluation, and when she is ready for me to come in and do your films, I'll be back in just a few minutes. Okay?
Very
Any
good.
other questions for me?
Are you going to be able to help me?
Well, that's what we're going to find out.
Okay.
All right. So
Nice to meet you.
welcome to have you.